Sounds good.
Welcome, everyone. Welcome, everyone. Thank you all for being here to the Messaging Matters webinar. I'm going to share my slides. What a great showing. Let's see, we have how many folks already? I can't see everyone because I'm sharing screen. Can you all see the slides?
Looks
Dina,
good, Sylvia.
you can see it? Awesome. Awesome. Welcome, everyone. Thank you all for being here. Zena and I would like to welcome you to our Messaging Suicide Prevention Committee Messaging Matters webinar. And please feel free to introduce yourself in the chat, your name, your pronouns, and affiliations. I'm Sylvia Tang. I use she, her pronouns. I am part of the San Mateo County Behavioral Health and Recovery Services Office of Diversity and Equity, and one of the co-chairs for the Suicide Prevention Committee. And Zena, do you mind quickly introducing yourself, actually?
Hi, everyone. It's so good to see so many of you here. My name is Zena Andriani. I use she, her pronouns, and I'm the Assistant Director of Services Crisis Intervention and Suicide Prevention Center. And I am the other co-chair of the Suicide Prevention Committee.
Great. Thank you so much, Zena. And I'll be speaking for the first 10 minutes or so, and Zena will be helping me with monitor the chat. And if you have any questions, you can put it in the Q&A. And then we will have our guest presenter. And when our guest presenter, Stan Collins, speaks, both Zena and I will be in the background monitoring the chat and the questions. So if you just joined, welcome to the Messaging Matters webinar. Please introduce yourself, your name, pronouns, and affiliations. And thank you, Zena, for putting that in the chat. Also, if you could share what do you want to get out of today's training, that would be really great if you could include that in the chat as well. And right now we are happy that we have 40 participants already joining us today. So we'll give folks maybe another 30 seconds to a minute before we get started. So as you wait, please introduce yourself, your name, pronouns, affiliations, and what you'd like to get out of this training. And just a reminder, this meeting is being recorded. So please note that in case you are sharing. I believe the chat might be shared with the webinar recording. I'm not quite sure. But we will share the recording with all registered participants in case you want to review any of this information or you want to share with any of your colleagues or your friends. And let me see, let me go to the next slide. So as I mentioned, this meeting is being recorded. Slides and recording will be shared with registered participants. And this notice on the right is just letting all of you know that this recording might be shared beyond this webinar. So we may share it on our social media, for example. So we just wanted to give you all a heads up. And then, as I mentioned in the beginning, and Zena mentioned in the chat, please introduce yourself, your name, pronouns, affiliations, and what you want to get out of today's training. That will help us, be sure we try to address what you're interested in. And then also, if you could help us complete this demographic survey, Zena, if you don't mind, as you mentioned, if you could put it in the chat, that would be awesome if you haven't done so already. But if you can click the link that Zena puts in the chat, or you can scan this QR code with your mobile device. And it really helps us understand who we reached and who we want to reach in the future. And it also helps us with funding for events like this. So we really appreciate if you could fill out this 6-question demographic survey. We'll give folks about a minute. I see Ernesto, you raised your hand. Let's see if I can. So as we wait, I think I can unmute you. Well, Ernesto, are you able to type it in the chat? Let me see if I can promote you to panelist temporarily. Okay, Ernesto, you're a panelist. Did you want to speak? I saw you raised your hand, or is that not the case? Did you want to speak, Ernesto? Okay, I'll put you back into participants, but if anything comes up, please just type it in the chat or in the Q&A. All right, so we will get started. If you haven't done so, please introduce yourself and fill out the demographic survey. And I just want to acknowledge that, you know, this is a really important work for us, and we are all affected by suicide. And I just want to emphasize that we're dedicating, you know, this work that we're doing around suicide prevention to those who've been affected by suicide, whether you've, you know, lost someone to suicide, you've attempted or thought about suicide. This webinar is really for all of you in our community to really help us prevent more suicide in the future. And we just really want to emphasize that, you know, the why behind this work and the people that we do this for. So I also wanted to showcase some of the artwork we have here that's part of our suicide prevention roadmap. Some of the artwork is through photograph or through poetry or quotes. And so you'll see some of it here, and you can find more on our website and our roadmap. But these are done by some of our suicide survivors. So I wanted to be sure to share that with you all and honor all of your work that you're doing and some of the loss that we have endured, and just want to collectively share that there is hope for us to work together on this difficult issue to help prevent suicide in our community. And we also wanted to acknowledge, you know, suicide is also a really big issue among our Native and Indigenous communities as well. So we do this for all our, we want to do this for all our events as well, but especially for an event around suicide and suicide prevention, acknowledging our local Indigenous and Native community members. So I just wanted to say that San Mateo County acknowledges that the land originally belonged to the, so right now in terms of San Mateo County, we sit on the Ohlone land, and this land that we sit on originally belongs to the Ohlone people and was stolen as a result of colonization. In addition to acknowledging that this land, we acknowledge the people, the Ohlone people, including ancestors who've lived here and elders and communities who live here right now, not just people in the past, but people who are living with us. And we just do this land acknowledgement as a small starting point to really help advance equity and wellness among our Indigenous community. And so here you'll see the specific tribes that are in our local Ohlone land. And we also have the Native Indigenous Peoples Initiative, which works on behavioral health initiatives. And if you're sitting on a, if you're not in San Mateo County specifically, and you're curious what Native land you're on, you can check out the bottom right website. And of course, we want to emphasize that, so, you know, when we talk about suicide, it could bring up a lot of personal experiences that we've experienced, and that can be challenging for some of us. And we just want to let you know that there's resources for you 24/7, and people, wonderful human beings at these different resource centers or resources. So we have If you or you know someone who's in suicidal crisis or emotional distress, you can reach out for 24/7 confidential support. You can either call the Star Vista Crisis Hotline at 650-579-0350, which is connected to the National Suicide Prevention Lifeline. You can also text the crisis text line, text BAY to 741-741. And you can also visit the Star Vista Crisis's website, sanmataeocrisis.org for teen crisis services. And there's wonderful people behind these numbers and resources, and we hope that you all feel free to access these resources for yourself or share it with a loved one. And for emergencies that need an immediate response, you can call or text 911. And we have a website here around guidelines when calling 911, especially around a mental health crisis. So briefly, just wanted to introduce the Suicide Prevention Committees since we're hosting this event. So the Suicide Prevention Committee is a coalition of community members, mental health providers, and others in the community who want to prevent suicide. And we welcome all types of partners and are so grateful for many of you who are already part of our committee. And if you're not, we welcome you to consider joining. It's open to the public. Zena and I are both co-chairs, as we mentioned in the beginning. So I just want to check in with Zena. Did you want to say any few words about the committee before we pass it on to Stan? Go ahead.
I don't think so. It's just a good opportunity to get connected, and so many of us are doing this work. And so all the ways in which we can come together and kind of learn from each other and work on projects collaboratively too, obviously helps to make change.
Great. Thank you, Zena. And I've noticed some hand raising. So if you do have questions, please put them in the chat and or put them in the Q&A. I apologize. Please put any questions in the Q&A. You're welcome to put comments in the chat. And, hopefully maybe towards the end, we can open up the mic more, but please, if you have any questions, put them in the Q&A and chat. Awesome. So let me see the next slide. Oh, and here is a picture of some of our dedicated suicide prevention committee members. Some of you, there's many more folks who aren't in this picture, but this is a picture of some of our members in the in-person location we were in previously. Oh, here, let's see. Let me double check. Okay, one more slide and then I'll pass it on to our guest speaker. So just to let you all know and give you context, this webinar is helping advance our suicide prevention, our countywide suicide prevention strategic plan, which we call the Suicide Prevention Roadmap. And we just released it. Our roadmap covers for the next 5 years from 2021 to 2026. And as you can see on the right, that's the image of the cover of our roadmap. And then on the left is our specific goal that relates to this webinar. So increasing the use of best practices for reporting around suicide specifically. But it's also related to some other goals we have around safe messaging. And I also want to direct your attention to the bottom left corner, because that's more specifically what this webinar is about, which is disseminating suicide safe reporting and messaging guidelines, disseminating information and or delivering trainings like this on best practices, guidelines for suicide safe reporting, suicide reporting, messaging to the media, entertainment, and community partners. So before I hand it off to Stan, I just want to thank all of you participants for being here. You might be part of the media, you might be part of entertainment, or you may be someone who just communicates about suicide and suicide prevention publicly. And each of you are very important in our safe messaging goal and work. So we really appreciate you taking the time to be here. I also want to appreciate Stan Collins, who is a subject matter expert for many years around safe messaging. I'll just briefly introduce you, Stan, a little bit, but I know you'll introduce yourself better. But I've worked with Stan for many years, probably since 2015, and just admire how dedicated Stan is not only an expert in this field, but just really has the heart for this work, and really cares about saving lives as much as possible, especially through the lens of communication and other areas too. But thank you, Stan, for being here with us. And I know your heart and mind is in a great place. So appreciate you teaching us, and we look forward to learning from you.
That's very sweet. Thank you for that introduction, Sylvia, and thanks for the invitation to be here. Sylvia's right, and I'm going to tell you a story about why I do this work, which is probably the most important part of my bio. Let me go. Actually, I'm just going to talk for a minute before I share my slides. But I was just looking through the chat. Everyone, thank you for, not just introducing yourselves, but providing some content for, what you're hoping to walk away with today. So as mentioned, my name is Stan Collins. I'm a suicide prevention specialist. I work with Know the Signs, coordinated and funded through CalMesa by county behavioral health agencies like San Mateo and counties across the state. I've been working in the field of suicide prevention for over 20 years. I do a lot of work in schools. I do a lot of work with across the board, county behavioral health. But one of my biggest passions is about messaging, because I think the ways in which we talk or don't talk, or how we communicate about suicide, whether that's on the individual basis, whether we're in a school setting, whether we're in a healthcare setting, whether we're talking to our clients or we're talking to our staff, we've seen suicide rates increase among healthcare professionals with the COVID pandemic. If we're working in first responders, behavioral health, whatever it is, how we communicate about suicide, and the more we do to eliminate the stigma and the shame associated with it, the more effective we're going to be. So we can have all the systems in place and all the processes and mobile crisis teams and crisis stabilization units there. But if we're not talking to people and saying that there's nothing there, it's not abnormal to have thoughts about suicide. If we're not communicating in a manner that is hopeful, that is building resiliency, and not just talking about how big the problem is, then kind of to some degree, the rest of the stuff really doesn't matter if we're not getting people in the door in the first place. So I'm really excited to talk with you all. You'll pick up from me. I'm a pretty informal person, or I try to be. So at any time, if type in the chat, type in the Q&A, we're going to pause intermittently to take questions. We're going to leave lots of room for dialogue at the end. But Sylvia, I hope you don't mind. I'm actually going to throw a little bit of a curveball into the presentation today, because as we're talking about suicide, I think it's important. One of the most powerful, impactful ways to talk about mental health and suicide prevention is through story, right? Storytelling has guided our cultures for years. And so I want to talk to you a little bit of a story about why I do this work. So I was born and raised in San Diego. Growing up, my brother had I'll see if this makes sense. My brother had a best friend who had a little brother. So anytime our older brothers went to the beach or went to the movies, because they would drive, they were 4 years older than us. Me and my friend, or who would become my friend, Jesse, would tag along with them. And I kind of jokingly say we had an arranged friendship. Like we were kind of forced in this spot. And I was pretty nerdy. Way before being a nerd was cool. I was going to Comic-Con 10 years old, looking for issue 111 and all the things, way before all the Marvel movies and things. Jesse was at the other end of the spectrum. He was kind of a tough guy. He had a shaved head, skater kid kind of, but I thought he was the man. He had this just coolness about him. And over time, we got to be friends. He taught me how to skimboard. And I was really lucky my freshman year. Jesse was a year older than me. And so Jesse was a sophomore my freshman year. And I was very blessed that my fourth period geometry class, because again, I was a nerd, so I was in advanced classes with juniors and seniors. I ended up in the same class as Jesse. And so every day my freshman year, I knew that there was an hour where I would be safe, an hour where, because our last names were similar or close in the alphabet, I could go sit next to one of my best friends. We'd go to lunch a couple more hours and the day was over. But one night I was coming home from practice and I was walking down the hallway of my house. And my older brother was coming towards me, and he had tears in his eyes. And I should provide context that my brother's now a law enforcement officer. I work in suicide prevention. So we're kind of opposite ends of the spectrum emotionally, where, I cry at Disney movies and Hallmark cards. And I think maybe this is one of 2 or 3 times in my life where I've ever seen that level of emotion in my brother. And so I knew immediately, even as a 14-year-old boy, that something was wrong. And I just could sense that whatever was about to get told to me was going to change my life. And he went on to tell me that Jesse had died by suicide that afternoon. And I remember the weight of the world hitting me with those words. I remember stepping back until I hit the wall and sliding down and putting my head between my knees and just being overwhelmed with emotion. And for those of you who are also lost survivors, you know, it's every emotion under the sun. It's anger, it's sadness, it's confusion, it's guilt, it's shame, it's just overwhelming. And you almost can't even hold on to an emotion long enough to process it before the next. You know, there was shock and confusion, but then anger kicked in. And anger is actually an emotion I don't think we talk about very much as loss survivors, because we feel guilty about having that anger. But there was guilt, shame, all these things. And I remember going to school the next day, and it just felt like this weird silence. Now, granted, this was in the mid-90s, so this is at a time when we really didn't do much suicide or postvention or prevention in the school setting. But I've been that kid. I remember walking in that fourth period class and opening up the door and hoping that he was going to be there and this was all going to be a bad dream. And instead, what happened that day and every day for the rest of the years, I sat next to my best friend's empty desk. And every day for 60 minutes, I wondered what I could have done, what I could have said, what if I would have stopped by. And so that fueled my passion a couple of years later. Again, I was 14 years old and I was left to deal with this loss and this death, this tragedy in silence. Nobody knew or connected. And my senior year in high school, I was introduced to something called the Yellow Ribbon Program. And it was the first time. I was 17 years old, and the adults in my life had talked to me about sex, drugs, rock and roll, all the way that kids can die. And yet no one had ever talked to me about the way in which my friend died, which was suicide. And so I got invited to this presentation on suicide prevention. And it was the first time I heard those words connected. And I was really excited just about that. And I walked away from that presentation thinking, man, why are we not talking about this? What's going on? And so I went to my principal and I asked him, I said, hey, let's do this. Let's do this program. We're talking about all these other things. We have the every 16 minutes drunk driving, we bring in a wrecked car, and yet we're not talking to kids about something that affects them even more. So over time, I wore him down, and he finally acquiesced and allowed me to bring the program to the school. And so the day came, and the founders of the program flew in from Colorado. And in the day, we did these type of presentations in the gym and these huge assemblies, which is something we recommend against today, because I always think, man, what if one of those kids almost certainly was actively having those thoughts, right? So anyways, right before the Dale and Darami, the founders of the Yellow Ribbon Program, were about to speak, they looked at me and they said, hey, have you thought about what you're going to say? And I said, no, because I'm not talking. I built it. If you build it, they will come. You guys are here. This is your show. And they said, we think your classmates would benefit from hearing your story. And so I panicked. I freaked out, right? I reach in my backpack. I pull out a poem that I had written in my English class in memory of my friend. It's called I'm Still Here Because You Were There. Obviously, the poem ends with the friend recognizing the risk and the warning signs and having a conversation, connecting to help. But I read this poem. And so just imagine this. Imagine your senior year of high school. I'm standing in front of my entire school, 3,000 people, and I'm reading poetry. And I'm just mortified. And I read the poem. I don't even know what I said. I think I skipped practice that day. I go home, I go to bed. And I just wanted to pretend like the day never existed. I'm thinking to myself, man, how could you ever be so naive to think that one person could ever make a difference? Why did you do that? You're an idiot. And just got ready the next day for school, just preparing for battle, thinking that I was just going to be ridiculed and whatever. And instead, what happened is I'm walking onto campus. The attendance lady had a window that faced the front of the school so she could see all the students as they're coming and going. And we made eye contact, and I saw her immediately turn around, walk out of the back of the building, and now she's making a beeline for me across the front of the quad. And I'm panicking because I was a good kid, but I was like, what did I do? I'm in school. Why is the attendance lady heat seeking me out from across the campus? And all of a sudden, as she gets close to me, I realized she had a sorrow in her eyes, but she also had some hope there as well. And I noticed she had an envelope in her hand, and she comes up to me and she says, Stan, I have a gift for you. And I had no idea all these years later what she meant, but the letter, it's actually, I keep it right here at my desk to remind me on the tough days, but I don't know how well this shows up, but that's the letter. And I'll just read it for you. It says, Stan, you don't know me, but what you wrote in your poem changed my view on a lot of things. I was thinking about suicide before I heard your poem. I lost 3 of my best friends and was really unhappy. I have your poem framed and it's in my room. I read it every morning when I wake up, and I will read it every night before I go to bed. I got an extra poem for my friend. She really liked it also. I now know that I have a purpose in life and that people do care about me. And I wanted to say thank you. Thank you for your pain. Thank you for caring. And thank you for your poem. Sincerely thankful, Sarah. To this day, I'm searching for Sarah. I tell that story hoping one day one of you will be like, wait, I'm Sarah. But I share that story with you because as a 17-year-old boy with no training in mental health, no training in suicide prevention, just simply because I was willing to say the S word and acknowledge that this is a thing we're dealing with, and creating that space to talk about pain, to talk about hope, I was able to help someone find their reasons for living. Now, I didn't convince her not to die. I helped her find her, I just assisted her in finding her reasons for living. But the main reason I share that story with you is because suicide feels overwhelming. Suicide prevention can seem monumental. But if, as a 17-year-old boy, I could have that impact on somebody else, my hope is that in hearing that story, you'll never underestimate the role that you can play in helping someone find their reasons for living. And I'm using that term very specifically because when I first lost Jesse, I thought for a long time that suicide was about wanting to die. And to be honest with you, it wasn't until I went through my own struggles and was at a point where I was wondering whether or not I should be here tomorrow that I really understood finally that suicide is not about wanting to die. It's about not knowing how to go on living with this pain, this emotional pain that feels like it's buried deep in your soul. And at that point, I realized, therefore, suicide prevention is not about convincing people not to die, because suicide's not about wanting to die. Suicide prevention is about helping people find their reasons for living. And in my opinion, when you simplify suicide down to its two most basic factors, it's about pain and hope. And suicide happens when that pain outweighs that hope. So who has better access to our pain and our hope than the people that we're connected to, our friends, our family, the people in our lives? And so I wanted to share that story again. I wasn't going to, but not only for that purpose, but I also wanted to share that story with you as an example of positive narratives and positive storytelling. To be honest with you, the first few years when I would share that story, I would just talk about the first part and losing Jesse and the trauma that came with that. And over time, I realized that no, there's more to that story, that we need to focus on hope. You know, so much of what we do in suicide prevention is actually can be traumatizing to folks. If I just left you with this sadness, if you walk away just shut down with sadness, how am I possibly going to help someone find their reasons for living? And so I also make it a call to action that we have to be critical. We have to evaluate when we're bringing in somebody to tell a story. Is this story beneficial? Are we just providing a therapeutic session for this person to talk about this story? Or is this story, what is the purpose? What do people want to walk away? What do we want people to walk away with? So I think that relates to the messaging. I hope that makes sense and ties in. Thanks, Jeffrey, for the kind words. But now we're going to jump into the presentation. So anyways, that's my story. That's why I do this work. And I really do believe that words matter, and communication about suicide, talking about suicide, can obviously make an impact. I apologize. Hold on just 1 second. I need to change something on the slide real quick. All right, let's see. All right, and Sylvia or Zena, if you could just verbally confirm, can you see the slides okay?
Yes, it looks great. And thank you again for sharing your story, Stan. That was awesome.
Oh, thanks. Yeah, let me know if you have any issues with audio or the slides. Otherwise, we'll just jump right in. So the presentation today is obviously how we message about suicide. Suicide and suicide prevention. Really excited to see, and thank you all for contributing your comments, what you're hoping to walk away with. I hope we're going to touch on everything, but when we get to the discussion at the end, if I haven't touched on something you want to walk away with, I don't want this to be a frugal, waste of our time. So please put me on blast and let me know, like, hey, you didn't talk about this. So please call me out. So with that, I'm here, as I mentioned, through Know the Signs, which is part of the CalMesa programs funded by counties through the Mental Health Services Act, Prop 63, and San Mateo has been a key contributor to those efforts. So thank you for the support over the years. And Know the Signs, we have a few different websites. Suicideispreventable.org. Our Spanish language is El Suicidio es Prevenible.org. I encourage you to visit those. And if you're interested in sharing information, reviewing warning signs, looking for ways to have a conversation with somebody, or local resources, you can find them all at the Know the Signs, suicideispreventable.org. This is what the website looks like when you get there. As you see, different sections on just being aware of the warning signs, how to have that conversation, and those resources like I talked about. We also every year come out with the Suicide Prevention Week kit, but we really try to make those materials applicable across the year. So it doesn't just have to be in September. So again, please engage comments, questions as we're going. And Sylvia or Zena, if there's a pressing question, please let me know, or again, we'll be stopping intermittently with Q&A slides. But let's jump into some background. Why does this really even matter? So for one, the national strategy, which was updated in 2012, highlighted how we message about suicide as one of the key strategies for changing the conversation about suicide prevention. Similarly, the 2020 strategic plan for California Striving for Zero, actually 2020 through 2025, identifies that how we message about suicide really needs to be a part, because again, it impacts so much of what we do. So this is not just me being passionate about messaging. This is national and state strategies saying that, yeah, how we communicate makes an impact on the work that we do. Now, based on the first national strategy, which happened in 2001 or was developed in 2001, I actually had the honor of presenting alongside the Surgeon General just a few days before September 11th as the national strategy was being debuted. But what that called for, obviously it got distracted with the events that happened a few days post that. But we got our momentum back, and in 2010, the Action Alliance, which is the entity behind the strategy, put together an expert panel. And they went out and they looked around and they said, what are we seeing? So that's this Charting the Future document. There's also been some polls over the years, AFSP and Harris poll recently. But looking at the data, most people agree that suicide is an issue. Most people support suicide prevention. Most people think that we should invest more in suicide prevention efforts across the lifeline. But when they asked that expert poll, what are the differences? What are the changes that we need to make? One thing that they found, which is still prevalent today, is there's too much of an emphasis on the problems, of the severity of the problem, and too little on prevention. I mean, it seems like every day we're reading an article about someone, a prominent person, whether a celebrity or whoever, dying by suicide. And aside from having the lifeline there's typically very little information on, okay, what do we do? Now, if we just acknowledge that most people agree that suicide is an issue, if we only have their attention for a few precious moments, rather than convincing them of something that they already know, let's tell them what to do about it. Let's let them know suicide can be prevented. Is it 100% preventable? Can it always be prevented? No, I would disagree with that statement. But is it possible to prevent suicide? Is it possible to help someone decide to live? Absolutely. I've seen it. Even through the losses in my life, I've seen people make a different decision. Also, what we see again is so many stories are about loss, and we see too few stories about hope, resiliency, recovery. I think the most common stories we hear is about suicide loss. We've heard more from the attempt survivor community over the last few years, which has been wonderful. But I think we also have to get to a place where we acknowledge, the estimates are that about 10 million people in America will consider suicide this year, 10 million people. And yet we still frame it as abnormal to have thoughts about suicide. And I don't mean to get too hippy dippy or philosophical, but when you look back to the great writings, the great philosophers, the operas and Shakespeare, suicide is a consistent theme. Our purpose, our life and our death, should we be here tomorrow, is not an abnormal question for people to be asking. Now, is it normal for people to be thinking about suicide? No, it's in this space between normal and abnormal. Probably the best word to use is common, but it's very common for people to go through a tough time and think about, should I be here? Do I have the strength to carry on? And this is more of a bigger picture for the suicide prevention field to acknowledge. I think we've done a good job in California with the green ribbon of having a unified message, but we need to bring more people together. We need people from the unemployment lines to Meals on Wheels to realize that they are also part of suicide prevention. I added this at the last second, so I hope it's all right. But in looking at some of the questions, a few of them were talking about what does this look like along culture lines and among race and ethnicity lines? And to be honest with you, in the 20 years that I've been in the field of suicide prevention, we have not done a good enough job of talking about, okay, what does suicide look like in different races, ethnicities, cultures? But a lady, Dr. Joyce Chu out of Palo Alto University, has really been doing a phenomenal job as far as shedding light on this topic. And we still have a long way to go, but I want to introduce you to this. Her paper is called The Cultural Theory and Model of Suicide, and she does a number of trainings across the state. She's a phenomenal person. This is a very oversimplified, condensed version of her conversation, but basically, when we're looking at suicide and how does culture impact it, one of the first areas we got to look is cultural sanctions. So the acceptability in a culture around suicide, shame associated, not getting into a college, teenage pregnancy, identifying as LGBTQ among different cultures could bring different levels of shame. That shame can be that straw that breaks the camel's back or takes away that support, those protective factors. So we have to be looking at suicide and not assuming that everyone fits in this cookie cutter version of what is a suicidal individual. Also, how we express or what's referred to as idioms of distress can be impacted by our culture. So the warning signs that we typically learn about in a suicide prevention gatekeeper kind of 101 training can be impacted. In certain cultures, those warning signs may not be as prevalent. They might be more used to wearing a mask. The means and methods chosen for suicide can be impacted. So we're looking at means safety efforts. We got to look at, well, what is the culture? How does that impact the means and methods that might be chosen? Again, she goes into greater detail about this, but I just wanted to introduce these ideas. I think it's pretty, easy to make the connection about why minority stress and social discord can further fuel suicide risk. But at the very least, I think it's important that we have these conversations, acknowledge that we simply haven't done enough, and we need to better understand this because we just simply have to. It's part of our job. If we're going to make a difference, we got to make a difference for everybody. All right, so from that chart in the future, one of the quotes that I like that came out of it is we need other people other than the choir to sing. We don't just need the suicide prevention field. We need, again, all of you coming here today, dedicating your time, whether you work in behavioral health in a community setting, for a nonprofit, whether you're just a concerned community member. We need more and more people to be having conversations about suicide prevention, and we need to empower people. Again, 20 years in this field, and I feel like we still have this mentality that it's only the people in the ivory tower that can prevent suicide. And when we do that, we minimize the role that every single link in that chain can play in helping someone find their reasons for living. That conversation with the stranger, the phone call to the crisis line, just the person in your life jumping in the mud with you and saying, I don't know how to fix this, but we're going to figure it out. And I love you. Sometimes that's all it takes to get somebody to hold on just a little bit longer. Now, the reason why all this matters, the evidence to support why messaging matters, the Action Alliance, as I said, that's behind the national strategy, has also been really pushing this effort around the framework for successful and effective messaging around suicide prevention. Now, first 10, 15 years I was working in the field, we spent a lot of time telling people, don't say this or people might die. So we came out with reporting recommendations, which were really valuable, helped to change the way that news media was reporting on suicide. I'll share it later, but there's now a toolkit out there for the entertainment industry on how, if you're going to write scripts and shows, movies about suicide, how to be respectful. But the research on this is known as the effect itself is called the Virtue effect. And it's based on a book called The Sorrows of Young Virtue, which is a book from back in the 1800s in Germany. The main character is a guy in his 20s who ends up dying by suicide. And as that book circulated through Europe, it was the first historical evidence of what we refer to now as suicide contagion. So there were individuals who dressed like the character, or many people who had the book in their possession at the time of their death. Again, not that it planted the seed. Talking about suicide doesn't cause suicide or like I said, plant the seed. But if it's negative messaging about suicide, it can push a vulnerable individual closer to a suicide attempt. So fast forward to modern times, we saw when Marilyn Monroe died, and the level of detail that was provided after her death was one of the first modern time historical incidents where we saw an increase in suicides among her age group. And then fast forward, more current, with Robin Williams, with shows like 13 Reasons Why, we saw a negative effect after negative messaging came out. So this is known as the Virtue effect. So again, we're trying to filter everything through a lens of safety, which is a core part of what we're going to talk about today. Now, over the last 5 to 10 years, there's been a push to look at, okay, well, what's the other side of the coin? What's the inverse? Can positive messages have a positive impact? And the answer is yes. An individual, Dr. Thomas Diemen-Krollenthaler out of the University of Vienna, has been one of the leading researchers, and I had the researchers in this area. I had the honor to present alongside him at a keynote at the American Association of Suicidology of how does this actually play out. So the Papageno effect basically says when we have positive messages, we'll have positive outcomes. And in the chat, if anybody knows where the name Papageno comes from, you'll get a gold star for the day. So just a little trivia to drop in on you. But what we're seeing is the more we have positive messages, some of you might remember a few years ago, Logic, a hip hop artist, came out with the song 1-800-273-8255 as the title of the song, which is also the number to the National Lifeline. And when he presented at the Grammys, performed at the MTV Music Awards, in the months and weeks that followed, we saw an increase in calls. The Magic Flute, well done, Ami or Amy. So yeah, Papageno is a character in the Magic Flute who is deterred from a suicide attempt by some boys in the village. So well done. So there's a lot of instances out there. There's more and more research looking at, we're always going to get more with a carrot than a stick, right? Instead of saying, don't do this or somebody might die, imagine what the other version of that is. Hey, if you do this, somebody might live. It might live. If you put the resource in your story, in your newsletter, if you educate people about warning signs and risk factors, people might recognize risk and intervene and engage with somebody. So anyways, that's some of the background as far as the why. You can go to suicideprevention.messaging.org to learn more. Again, with Papageno, we're trying to increase help seeking, more awareness, destigmatization of mental illness and suicide. And we're trying to avoid the virtue effect, right? We're trying to avoid those reinforcing negative stereotypes, inaccurate or stigmatizing perceptions. Now, when you look at the framework, it gives 4 buckets, right? What is our strategy? So we're going to spend a little bit of time on that. Again, we're going to talk about what does safety mean? How do you filter communications through this lens of safety? How do we reinforce that positive narrative? How do we bring more sturdiness to those narratives? And there's also guidelines. We're not flying in the dark anymore. We know what works and what doesn't. So we need to adhere to those recommendations. All right, I'm going to pause for just a second. See a couple kind words coming through from folks. Thank you for that. Thank you, Estrella. Thank gold star again to Amy or Ami out there. And I just want to see if I'm missing any questions that have come through. Zena or Sylvia, if you could let me know if I missed any. And Jay, thanks for sharing that resource. I definitely am going to check that out. I'm excited. I'm going to share another resource as well that's more of an AI algorithm type tool. But for now, I'm not seeing any questions. So we're going to continue on. So when it comes to strategy, just ask yourself, what is our strategies? Too quickly, especially when I work in like school or community settings, like we need posters, we need brochures. Now those can be really effective, but why do you want brochures? Why do you want posters? Decide the why before you figure out the how. And I'm going to share with you some examples later, but for example, if we say suicide is preventable, talk to your doctor. Have we gone into the communities and trained healthcare professionals and primary care physicians, physicians assistants, nurses, front desk staff about suicide risk screening, about triage processes? We need to think of what is it that we're trying to accomplish, and before we figure out in what format is that going to take. So again, this is just another visual representation. Figure out the why, figure out the who, figure out the what, and then figure out the how. Too quickly, we jump to impact data, and we say, oh, well, we distributed 2,000 brochures. Well, who was your target audience? What were you trying to accomplish? So just a couple thoughts as you're jumping into your suicide prevention activities in whatever capacity you're working in, just to think, take a little more time with that. So now we're going to talk about safe and effective messaging. So we're going to talk a little bit about that lens of safety. As we do that, I want to share with you a quote. This is from the Associated Press Vice President for Standards. And what he mentions is that reporting on suicide, like reporting on sexual abuse, is one of those areas in which we favor not saying all that we know. And what he's talking about is a lot of times, especially in the past, there was detailed descriptions of means and methods. We saw this, unfortunately, with Robin Williams, the medical examiner, getting up and saying to the world, this is exactly how it went down. Some might argue there's public interest, but I hesitate or have a hard time seeing what was the public good in that level of detail. Now, conversations about means and methods, means safety absolutely need to happen, but the level of detail that is pertinent to the public, it varies case to case. Now, I've been part of efforts in San Diego County to put a barrier on the Coronado Bridge, and in those conversations, we do need to communicate about the number of people who have died from the bridge. We saw this with the Golden Gate Bridge. But we have to just think about, is there a purpose behind this, or are we just trying to scare people or grab their attention? In which case, I'd say that information could probably be left out. I'm going to introduce you, or you may have heard this before, recommended language about suicide. The suicide prevention community has for years been trying to just clarify the terminology we should use around suicide. So if you'll engage with me in the chat, if you could open up the chat, I want to do a little word association game with you. Because the most common term that we use when someone has died by suicide is that person committed suicide, right? So what are some of the other actions that we commit? Fill in the blank. We commit blank. We commit blank. So please engage in the chat. What are some of the other ones? We commit felonies. We commit crime. We commit murder. We commit sins. We commit treason. We commit adultery. We commit perjury, acts of violence, arson. We get committed to mental institutions. So that term committed, as we just saw, has a very negative connotation, right? Now, the truth is that we commit to a lot of positive things. We commit to our friendships, our relationships. You committed to spending 90 minutes here with us today to improve your messaging. So we commit to a lot of positive things, but that term committed oftentimes brings with it a negative association of crime or sin. People are surprised often to find out that attempting suicide used to be illegal. A lot of faith institutions are starting to change the way they frame suicide, because framing suicide as a sin hasn't prevented suicides from happening. What it's done is prevent people from seeking help. And so rather than using the term committed, we ask that people use the term died by suicide, died of suicide, or took their own life. And as you see, we're not trying to skirt around or hide that suicide occurred. We're trying to remove the association of crime or sin with that act. You'll also hear people refer to successful or unsuccessful attempts. If you break that down, if someone successfully attempts suicide, they've died. So there's really no success, or the term success or lack thereof really doesn't make sense. So these are either attempts by suicide or deaths by suicide. I'm not trying to hide the incident or the result. We're simply trying to take away that stigma and bias associated with it. So I encourage you to please try to shift your terminology. You're going to catch yourself. Please, if you're at dinner this weekend and someone uses the term committed suicide, I don't think we get anywhere by attacking people. So use it as a teachable moment instead and say, hey, you know what? I was actually at a webinar this week, and I learned that we're encouraged to not use that term anymore because of the association with crime and sin. And I've heard you're instead just supposed to use the term died by suicide. And just have a conversation. That's how change happens, not with attacks. All right. So as we're talking about unsafe messaging, again, this is every message we put out there, whether it's a newsletter, a statement to parents after a suicide, whether it's a news report, a communication to our staff. We want to filter everything through a lens of safety. So we want to avoid that unsafe content that I'm going to share with you. Now, anytime we talk about suicide, we need to make sure that we're providing folks with a resource. Unfortunately, a lot of times we'll have conversations and we forget where to tell people, or the opposite is true. And we're here to talk about suicide prevention. We give people every resource under the sun. And if you've ever tried to look for a mental health professional on your insurance website, you know that sometimes you can have so many resources that you don't have any resources. So you want to be very clear and consistent, sharing your local crisis line, the lifeline, the crisis text line, based on your audience, right? There's also Trans Lifeline. Trevor Project has a crisis hotline for youth and young adult LGBT individuals who identify as LGBTQ. There's different lifelines or crisis lines for various populations. So, be clear when you're sharing the resource, but don't overwhelm. But anytime, just realize that we call it trauma informed, but even right now, every time we talk about suicide, we have to acknowledge that there might be somebody who's hearing this message or sees this message that right now, today, might be debating whether or not they should be here tomorrow. They may be ambivalent. And so we have to give them, knowing that this conversation might raise those emotions to the surface, an opportunity to reach out for help. I think another thing that would really help us is that we need to demystify these resources. It's one thing to share the lifeline or say, if you need help, call the lifeline, but we need to communicate to folks. When you talk to the average person, they think that calling the National Lifeline or local crisis center is similar to calling 911, where there is a threshold of crisis that you need to surpass before you reach out to them. And that's just simply not true. If today, after this presentation, you have emotions rise to the surface and it brings up a loss or maybe your own thoughts that you've been struggling with, you can reach out. You don't have to be in crisis. You can be in distress. You could be having a bad day. You could just need to talk to somebody because you're feeling lonely and contact them. You could have recently lost somebody to suicide or years ago lost somebody to suicide and say, I've never talked about this loss and I need to communicate about it. We need to remove barriers, especially when it comes to youth. I talk to youth And there was a statewide mandate that requires that these two resources are put on the back of student ID cards. And yet very few schools are explaining to youth or removing barriers to youth reaching out. You know, some kids will tell me I would never contact that lifeline because my parents monitor my cell phone calls. So if they see a 1-800 number, they're going to think I'm getting into something. So we have to dispel the myths about it. We have to get people to understand that there are plenty of people out there to take these calls. By contacting, you're not burdening somebody. You're not taking that call away from someone else. We really have to do a better job communicating about what these resources are, and perhaps more importantly, what they are not. Going back to the cultural considerations, we have to understand that there are certain communities in our populations, that are going to not want to engage with law enforcement, that have fearful or traumas based on that. So what are the other options, and help them to understand that the people at these crisis centers do not want to engage in active rescue unless absolutely necessary and that suicide risk is imminent. So just a little bit about resources. Thanks, Letitia, for the thumbs up and the love out there. I appreciate that. So this would be an example of a positive way to communicate. So rather, again, than saying 50,000 people died by suicide last year, be afraid, be very afraid, it could happen to anyone. Instead, what about saying, hey, last year over 200,000 people, almost 300,000 people contacted the Lifeline to try to find their reasons for living. So instead of normalizing suicide, we've now have normalized help seeking. We have normalized people reaching out for support. So how we frame this, so that normalization of help seeking, promotion of the resource, and saying, hey, we all go through tough times and these resources are available to you. Now, when I first got involved in suicide prevention, we were very guilty of using normalizing statements, like every 40 seconds somebody dies, or attempts, every 12 minutes somebody dies. And the reason why we were doing that is because it felt like nobody was talking about it. It felt like we were on the top of a burning building and we were saying, please bring water, there's a fire over here. And we were trying to get people to just engage and pay attention. What we've come to understand is the data I showed you earlier. Most people agree that suicide is an issue. So if we only have their attention, we don't need to convince them of something they already know. And the risk that is present when we do that is that we might normalize suicide for someone who's debating about it. I'm going to share with you here in just a second another example, but we have to be careful that we're not taking these statements and inadvertently reducing a protective factor from somebody, thinking, oh, well, somebody's going to die in 13 minutes, might as well be me. And that's not to simplify it, but this is the kind of conversations we need to have. We need to be critical about the messages. So in the chat, if you'll please engage with me on this one. So looking at this, knowing what we've covered so far, what is your evaluation? Good or bad, positive, negative? 22 veterans commit suicide every single day. What are your thoughts on this one? It's tragic. It's kind of fear mongering. It's not good. Well, also it is true. It's a scary high number, uses the C word, heartbreaking, it's bad. They use the word commit. It is devastating. It absolutely is, but it goes back to those scare tactics. So let's break it down. Now, that being said, when the American public learned that 22 veterans a day were dying by suicide, it was a huge call to action and awareness, and it caused the look at the VA and the supports, more funding to the VA. So positive action came out of it. But ultimately, this has an undefined audience. Who are we talking to? Now, if I'm going to a politician and saying we need more support for our veterans, I would absolutely use a statement like this. I wouldn't use the term commit, but I'm trying to let them know the severity of the problem. Now, the inverse or a different scenario, what if I'm a veteran? And what if I'm currently having thoughts of suicide? And I walk down a hallway at the VA that says 22 people who are just like you are going to die today. What that inadvertently does is removes a protective factor, a protective bias against suicide. So we have to be very cautious about this, understanding again that anyone who gets exposed to our message could actively currently be ambivalent about life or death or even thinking about suicide. But again, it doesn't really tell us what to do. It also oversimplifies the causes, which we're going to talk about in just a second. It's saying, well, if you're a veteran, then therefore you are broken and therefore you have thoughts of suicide. We see this with LGBTQ populations among youth, and we're going to dive into that one a little bit more here. So just want to get you kind of thinking and being critical about this. All right, here's another example. Look at suicide statistics. 1 million people per year commit suicide in the US. So we see that C word again. Suicide rates. Suicide is the 11th leading cause. So again, very kind of scare tactics, very For one, the suicide prevention community, there's no research to support this. Using the color red doesn't cause suicide, but there is an obvious association from that color. It's not really a positive color. It's associated with blood and other things. So we try to get people to avoid using red in their suicide prevention efforts. But the whole thing's about the severity of the problem, right? No focus on prevention, no telling people what to do or call to action. It's really dark. You know, the crosses here are very tied to one religion over another. The language, the way they use data is all very negative. So again, just you know, being critical. And I just got to note that there's some questions in the chat. I apologize. Okay, I see him. Sorry, I didn't have my Q&A open. So one question that was asked is completed suicide something we should stay away from saying? That one I would say is yet to be determined. The idea behind not using the term completed was that when we complete something, we've you know, succeeded at something, it's a positive, we've accomplished a task. Some people will say that, you know, that's not the association that I make, but I think there's enough people who prefer to not use the term completed that I'm of the mindset as best as I can. You know, if someone tells me that a term bothers them, then I try not to use it. You know, I'm not tied to it. So I would say that the suicide prevention community is mixed on whether or not to use the term completed, but if it bothers some people, I would encourage you just to avoid using it. You know, again, if we just are simple, it's a death by suicide or an attempted suicide, it's very clear of what the outcome is from that. And, you know, some people also say if we start striking words from our vocabulary, at some point we're going to run out of nouns and verbs and adjectives. So I see both sides of it. But for me, again, I think, you know, if it bothers somebody, then I don't use it. So the other question is, what's your experience with dealing with situations being shared on social media like Reddit and Twitter that completely disparage suicide prevention hotlines? I'm seeing it more and more with youth, seeing it as a major barrier, but it's hard to address all the misunderstandings post by post. For instance, one of the most common misunderstandings, how the Lifeline works, and the two reporting requirements and how it can change from county to county. Again, I think this goes back to a conversation about crisis lines. I think for those of you that don't know, sometime this year, the Lifeline this year into next year, we'll be switching from the 1-800 to a 3-digit 988 number. So I think positives and negatives, right? It's an easier number to remember, but some communities will say, well, it sounds very similar to 911, and that might, you know, we're going to have to message and let people know it's different, talking about those thresholds, talking about how communities might have negative experience with first responders in the past. You know, crisis center to crisis center are different. Some crisis centers are only staffed by volunteers. Some are staffed by minimum of a master's level in mental health clinician. So the services provided can vary, but I think in general, for the most part, people do a good job. You know, do they get it perfect all the time? Absolutely not. But I guess I would say, you know, in those situations where you see those negative posts on social media, tell them to try again, try a different crisis resource. Crisis resources similar to suicide loss support groups aren't for everybody. So finding the resource that works for you. But I think the more that we can communicate to folks, don't wait till a crisis. If you're in distress, you need to talk to somebody, you're looking to find a resource for someone else or looking to identify a therapist. The more that we can do that, the better we'll do. Are crisis lines perfect? Absolutely not. Are there really amazing people that volunteer and work on those crisis lines? Absolutely. You know, so try and try again. Tell those people to be gently persistent. So I don't know if that specifically answers the question, but the more that we can redirect to the positive, I think is the better. To the other question that just came in about social media posts, which cite a suicide statistic and then link it to a population. I'm going to circle back to that one about population specific data here in just a few minutes, but it's kind of in line with that veteran statement we just did. So we'll come back for questions here in just a moment, but for now, let's talk about avoiding description of the myth. So there was that quote from the AP style guide earlier. It said, as much as we can, let's try to avoid anything that's not necessarily to the conversation. And unless it's pertinent, you know, when, I don't know if statewide you're familiar, but Junior Seau was an NFL football player, played for the San Diego Chargers. And when he died, he died, and this is some activating content, so I apologize, but he died utilizing a firearm. There was a lot of detail about the location of his wound, the type of firearm that he used. And part of it was around that he wanted his brain to be researched because he was certain that he had traumatic brain injury, which is why the wound was in a place other than the head. But the focus on the type of firearm, that didn't really matter. Who cares what type of a firearm it is? And the danger in that is that someone might then associate with that firearm. But it was pertinent to the conversation about his brain health, that it was not a wound sustained to the head. So again, these aren't hard, fast rules. It's just for consideration. Is this pertinent to moving this conversation forward? And sometimes the answer is yes. And yeah, I do need to share this level of detail. But for the most part, I would argue there's plenty of times where we don't need that information out there. All right, so another one back to you. Looking at this, suicide statistics and warning signs, what are the good, what are the bad based on what we've talked about so far? Knowing we got to be careful about normalizing statements. We want to be careful about describing methods, language. What are some of the pros and cons about the one that you see on the screen now? So again, if you could just type those in the chat, what are some of the positives or negatives on this this infographic you see? TMI, I would agree. Negative images. Yeah, you got the image here of the firearm, which can be very traumatic to folks. Again, I apologize for my previous statement about the junior sale, but it's pertinent to the conversation. This poisoning, I understand that's, skull and crossbones is a symbol for poisoning, but it's just a negative thing. The how is very much highlighted, right? And this is just for public dissemination. Our conversations about means and methods should be a little more contained. So gives details about methods is very triggering. The $sign, I don't see that part. Let's see. I don't see that. Oh, the price of suicide, the cost. What does it cost? I'm sorry, that was right there. So yeah, like what is the cost of suicide? Thank you for pointing that out. I apologize for not pointing that out from the jump. Again, no call to action, no resource either, right? So this is very triggering and yet or very activating and yet there's no resource. So yeah, I agree. There's images of means and methods, focus on severity, no prevention, and horrible language. Just not a good example. All right, so our next one is going to talk about the causes or oversimplification of the causes, but let's just ask real quick in the chat again, what are some of the causes of suicide? What causes suicide? So let me know what's in the chat. What do you think are some of the causes for suicide? Hopelessness, we talked about hope and pain, so overwhelming pain or hopelessness. What are some of housing insecurity, chronic pain, poverty, breakups, financial stress? All these are true. Pain is greater than hope. Traumatic brain injury, stigma, no way out, bullying, traumatic events. All these are accurate. And yet at the same time, I would say they're all slightly inaccurate. The reason why I say that, I would say hopelessness and overwhelming pain are probably the most accurate. But I mention this because you see this image of the board game Jenga. If you're not familiar with Jenga, you stack up blocks, you pull out blocks, and eventually some person will pull out this block right here and it will cause the whole tower to fall. And we say, well, that person loses, right? Because they pulled out the one block, caused the whole thing to fall apart. Now, in reality, we know it wasn't that one block. It was all the other pieces that have been pulled out that weakened that infrastructure that led to that one block causing such devastating consequences and everything falling apart. And if we use this as a metaphor for suicide, oftentimes what we point to as the quote unquote cause of suicide is really just the straw that broke the camel's back, whether it was the breakup, the financial stress. There's no one cause of suicide, rarely if ever. The reality is there's a lot of things going on. I mean, even in the one Allie put housing insecurity, chronic pain, poverty. I mean, all those things are contributing risk factors. And there typically is a precipitating event, but it's not just one thing that causes suicide. We have to be really careful. A lot of times when we make statements about, oh, well, he killed himself or she killed himself over a broken heart. When we say that, use terms like bullycide or they were bullied to death. Truth is, most people go through breakups and divorces without dying by suicide or attempting suicide. Most people deal with bullying. Most people deal with poverty and financial insecurity. So we can't say, because when we say causes, we're saying if this, then that. If you are homeless, if you are identify with a certain population, if you lose your job, if you go through a divorce, then you will consider and think about and attempt suicide. And what that does is it removes a protective factor. We don't want to normalize suicide as the common response to fairly normal life circumstances. Do all of those things that you mentioned contribute to suicide risk potentially? Absolutely. But we have to be careful because, again, we don't want to normalize suicide as a response to a fairly common life circumstances. And one of the prime examples of this, for years, we've been talking about how youth who identify as LGBTQ plus have been disproportionately affected by suicide compared to their peers who do not identify as LGBTQ plus. And with that, some people took that message and they turned it on its head and used it as a negative and used it as like this statement, well, therefore there's something wrong with LGBTQ youth that needs to be fixed. And that's totally inaccurate. But it's also inaccurate to say that people think about suicide just because they identify as LGBTQ. Many folks who identify will not think about suicide, even if as a population, they are disproportionately affected by it. There's this toolkit talking about suicide in LGBT populations. And as you see from the quote, it says that it is the minority stress, it is the discrimination, the harassment, these negative outcomes, rather than the minority sexual orientation or gender identity per se, that appear to be the key risk factors. So it's not being LGBTQ, it is the harassment and the potential for harassment, discrimination, lack of support that can come with that. So it's not something that's wrong with the individual, it's something that's wrong with our society or our community or their circle of support. And I think this parlays over to the veteran conversation we had earlier, or a variety of the other populations that I personally do not like the term high risk. I don't like when people say that LGBTQ youth or Native or American Indian individuals are high risk for suicide, because that's saying that there's something wrong with those individuals and something wrong with that population. I like the terminology disproportionately affected by suicide based on their population numbers or compared to other cultures, populations, races, ethnicities. A larger percentage of this group think about, attempt, or die by suicide. But there's nothing inherently wrong with identifying or being part. And none of us want to tell that just because of one part of who we are, that we're broken or we're more likely to die or attempt suicide. So just some thoughts, again, just thinking about how do we communicate about suicide in general. I know I want to leave plenty of time for discussion, so I'm just going to move through some of these examples. So one of the things I like about this one here is this part where it says, let's see, not that part. Oh, supportive environments are key to mental health. So it's not just highlighting the risk, but it's also highlighting the protective factors. So if we push back and we provide safe environments and safe supports, we can actually reduce that risk, provide these to folks. They're still not perfect though. A lot of misuse of the data, focus on severity of the problem. There's no resource here. So again, even when people get it partially right, there still could be that danger of missing that safety element to it. I'm going to go ahead and pause there and see if there's any questions. Yeah, one question, I believe this will be recorded, so that you will be receiving a recording link, anybody who registered. Sylvia, I'm also happy to share a PDF of these slides if folks would like to have access to the resources and links that I'm sharing along the way. All right, so when it comes to positive narrative, again, I shared my story earlier. I hoped you walked away from hearing my story feeling, like a little bit hopeful. Yeah, we can do this. We can do, if he can do it at 17 years old, then I surely can talk about suicide. But we have to counter the negative. We have to stop pretending that people who think about suicide are these fragile pieces of glass that need to be held with baby gloves for the rest of their life. Most people will experience post-traumatic growth after suicide. I'm actually recovering from a broken leg right now, which I know is not medically accurate to say this, but they say that broken bones grow back stronger. If we use that in an accurate medical analogy, most people who go through a suicide incident come out of it with better skill building, better strength. 90% of people who attempt suicide will not go on to die by suicide in their life. 70% of people who attempt suicide will not go on to attempt again. So we have to stop letting people, push this agenda that when you're suicidal, you're, you've lost your capacity to be a competent citizen. And I think that's part of the reason why we're so shocked when we see Anthony Bourdain's and Kate Spade's of the world die by suicide, because we forget to realize that someone can be firing on all cylinders in certain aspects of their life, but if they have that pain in their soul, That's the part that matters. You know, people who can still show up for work, perform well. Um, it doesn't mean you're just incompetent because you're having thoughts. You know, again, I think it's a fairly human interaction or state to be in, to wonder about, should I be here tomorrow? So we need more and more stories of people sharing their hope, their hope and what helped them. We need more stories of people saying, I was having thoughts of suicide, but then I reached out to the crisis line or got support, and this is what it looked like. We need to give people concrete actions. And we need to share successes, not just, again, oh, we gave out 1,000 brochures, but the crisis line responded to this many calls. This many people who saw that decided to engage. So we really need to do a better job of normalizing help seeking and normalize suicide. I'm going to just breeze through this one and go ahead and answer it myself. But looking at this one, it's got the resource, it's action oriented, talk to somebody, it's prevention focused, no statements about the commonality or how, you know, frequent suicide happens. So in review, that framework for successful messaging, we want to determine our strategy, define our goals. We want to filter every communication we have through a lens of safety. We want to more and more provide that positive narrative. And now I'm going to talk to you about a few of the guidelines and sources that we have out there. Or I will in just a second. I'll share with you some of the toolkits that are out there. So if you're only going to do one thing, you don't have time for it all, include a resource. Whether it's a good story, a negative story, if we provide a resource, at least we're giving people that outlet. As much as possible, educate folks, let them know about the warning signs, that it's okay to talk openly and directly about suicide. That talking about suicide doesn't cause it to happen. Unless it's pertinent and necessary to the conversation, don't describe details about means and methods or mechanisms. Quote experts, not just the neighbor down the street who thinks they might know, but I work on the San Diego County Suicide Prevention Council, and we have a speakers bureau. So we have individuals who, when the media reaches out to me, I can say, oh, you want to talk to somebody in this population or that level of lived experience. Okay, let me connect you. We put them through this training. We help them be prepared. And as I've said numerous times, these are recommendations. These are not hard, fast rules. These are not guidelines. For any of you who are part of the media or working with the media, more, if you're a PIO, public information or communications officer, trying to avoid an us first them mentality, realizing that members of our media are also members of our community. They are also people with lived experience, loss survivors, attempt survivors. They may also be people who are actively thinking about suicide. So let's work with them as a team, helping them to understand that what the impact that they can have can prevent suicide. Help them simplify the process. Like I said, provide them with the speakers bureau list. Hey, here's a list of contacts. Oh, you need help finding somebody? Let me help you. So help them help you to get to that right conversation. Be gracious. Tell them thank you for highlighting suicide prevention. And also realize, you don't have to take every interview request. And I feel a burden on that when I get an interview and I don't have time and I'm like, oh, if somebody else does it, they might screw it up. But there's certain days where this work is daunting and I just don't have it in me to have the conversation. There's recommendations for reporting on suicide. Please make sure you share those. You can go to reportingonsuicide.com to download those. When you're doing the interview, I like to stand up. When I'm not broken, I like to stand up just to give me more energy, more pep in my step. And what I always tell people is when you walk into an interview, come in with 2, maybe 3 things on a Post-it note, and those are your goals. Redirect the question and make sure you're achieving your goals. And if there's ever that one statement you really want to, get them to highlight the National Lifeline, use the reporter's name. It's a trick that one of my mentors told me, and they said, oh, well, thank you, Bob, for asking about what people can do. And people can contact Bob, the National Lifeline, at 1-800-273-8255. And it's just a little ego thing. If their name's listed there, they might be more likely to use that segment. In the chat, though, if you could please let me know if you got any other tips. There's a lot of other people with more skills than I have across the board. So please put any other tips you have for working with journalists or media on suicide prevention. A couple of you asked about social media. One of the other things that we did with the Suicide Prevention Council in San Diego County is we created about 25 posts that would respond to negative posts. So when a couple of you asked, like, when the posts go negative, how do I get it back on track? So we had some prefabbed, predetermined posts that people could just copy and paste, making all the people in our council advocates for that. But I also wanted to share with you the National Lifeline put together this kind of clearinghouse of resources for social media. So all the major outlets from Facebook, Twitter, Instagram. At this point, most of them have some sort of mechanism for reporting posts or checking in on somebody. Facebook probably has the most robust. They have mental health teams across the globe that look at, evaluate, send the response. But this is kind of a one-stop shop where you can link this. This is a great resource to get out to the community so that folks can understand how they can report a post, how they can respond. But what's ironic about all of these responses is that all these social media outlets will say the best thing that you can do if you know this person is reach out. Give them a phone call, tell them you care about them, have a conversation about suicide and connect them to resources. So it all comes back to that connectedness and those human interactions. So a few of those resources, I mentioned this one earlier, reportingonsuicide.org. The recommendations are in a variety of languages. Anytime I do an interview, I email these ahead of time when the journalist comes, or if we're doing it over Zoom, I ask them, hey, did you look at the recommendations? Oh, no, I got busy. Okay, well, I'll wait while you review them. I'll conduct the interview when you're done reviewing these recommendations. And it sounds like kind of a hard line to take, but I want to make sure that I'm not doing any more harm than good in these situations. On the reporting website as well, I'm going to show you a mechanism here in a second where you can copy and paste something in to review it. But there's toolkits for populations. I mentioned national recommendations for depicting suicide or television and entertainment media. The Know the Science team has a Making Headlines toolkit for you, how to use social media. So there's a wealth of information and resources out there for us. This is that widget I told you. If you go to reportingonsuicide.org, here's the direct link. If you're putting on a newsletter, if you're a journalist and you're putting together an article, you can copy and paste it into here. And it's got AI algorithms that will evaluate, does this filter through that lens of safety, whether it's excluding information about methods, including a resource, whatever that may be. So really valuable thing, again, even within your business, if you're sending out a newsletter on mental health, popping it in there and seeing if everything is online. So again, Know the Signs. One thing I didn't mention earlier is that we can give you a code to embed these websites on your business, your organization, your school district website, so that you don't need to recreate the wheel. We just pop up in a little window and they would have full access to the Know the Signs or El Suicidios prevenible.org website. But I encourage you to visit if you want to learn more about warning signs, how to have that conversation. And for those of you who are not familiar, I'm also the founder of the Directing Change program, which invites youth to submit 60-second films on mental health and suicide prevention. Our deadline is actually today. So we're getting hopefully over 1,000 films from across the state. One way to put what you've learned today to practice would be to sign up to be a judge. So you can email Devin at Directing Change. I'm going to type her email in to the chat. It's a fairly easy commitment of a couple hours. You'll review youth films from across the state. So please reach out to Devin or myself if you're interested in being a judge for Directing Change. I just dropped that in the chat. Other than that, we're going to open it up for questions, discussions, any general questions, info@suicidispreventable.org. Questions specifically for me is Stan at Suicide is Preventable. I'm going to put that in the chat right now. And we're going to open it up for questions and see what's out there. So Sylvia or Zena, anybody?
Well, first of all, thank you so much, Dan. That was a really robust presentation and appreciate that. I remember there's one question. Was it the one more question in the Q&A? I forgot if you addressed it already from anonymous attendee. Was that addressed already?
I think I peripherally kind of addressed it. You know, the question was, I see a lot on social media in which people cite a stat and then they link to a crisis line. Again, I try to avoid stats. I think that people know that suicide is an issue, and the more that we highlight that this population is at risk, it can create danger. So I like to normalize help seeking. So rather than saying, you know, LGBTQ youth are this much more impacted by suicide, I would rather say this is how many LGBTQ youth and young adults last year contacted the Trevor Lifeline to try to find their reasons for living. So I always try to focus on the positive, but it just kind of depends on the context and the conversation. So I'm sorry, I can't offer a perfect answer to that. But help seeking statistics are always much more powerful in my opinion.
That's helpful. And we're getting positive comments in the chat.
Oh, I see that. Thank you, Linda. Good to see you again.
And just welcoming everyone. If you have any questions, please, if you can put in the Q&A section, but I can also read them if they're in the chat. Thank you all for participating. We still have we're still doing Q&A right now, and we'll have a wrap up towards the end, but
Yeah, we're gonna hang out for a few minutes. So if anybody is more comfortable unmuting, you can raise your hand and we can unmute you if that's all right. Type it in the chat, put it in the Q&A. Let us know. Well, I'm not seeing anything come in. So Sylvia, I know you had a few things you wanted to cover. Oh, actually, a question just came in. So when do you share warning signs, risk, and protective factors? For one, I always think it's really important that we include protective factors. I think we spend far too long talking about warning signs and risk factors. We really need to emphasize protective factors because that's really what distinguishes risk from one person to the other. Because you could have two people check every box when it comes to risk factors, but one person's got a therapeutic relationship that's established and the other doesn't. One has a support network, the other doesn't. One has negative coping skills, the other has positive. So emphasizing protective factors. But I think anytime that we have the ability to educate people about what to look for, and not so much what to look for, I mean, it is that, but I think instinctually to some degree, we all know when someone's struggling. It's in our instincts, it's in our human intuition. When I share warning signs, I try to really emphasize the ones that people don't expect. For example, anger, agitation, recklessness are warning signs associated with suicide that I don't think we talk about enough. I think the average person would know that if their friend is crying to go over and console them, but when someone is acting out of character and acting angry, our instincts are to push them away. So I think we can do a better job of letting people know to trust their instincts. But the short answer is anytime we can educate people, let them know what to look for, how to respond.
thank you, Stan. And we have one more question in the chat. So the positive language to use would be the person died by suicide. Is that the current language? Just double, sounds like they're just double
Correct.
checking.
Yeah, so the current language would be an individual died by suicide, died of suicide, or even took their own life. Again, what we're trying to do is be clear about what happened, but again, the safest is either a death by suicide or died by suicide or an attempted suicide. Again, it still is clear about what the results of that were without that stigma, bias, and shame. Anne-Marie, thank you for the kind words on the appreciation of focus. Arjuma, thank you for those kind words about shifting language and positive dialogue as well. One of the questions I see is any messaging specific to older adults that you would recommend. I really think it's part of our culture that we need to change, which is depression and sadness are not a normal part of aging. You know, I hope as I get older that I'm going to find more resiliency and more peace and more comfort in my own skin. So I would think the messaging that I've seen that I like the most for older adults is that depression and sadness are not a normal part. If you're feeling this way, reach out, talk to somebody, get some assistance. So I do think that would be my one recommendation about that. Some more positive feedback. Thank you again, everybody, for being here today. Well, Sylvia, I know there's a couple things you wanted to talk about to wrap up, so I'll turn it back over to you, but I'm going to hang out for a little bit. So if people have more questions, please go ahead and type, and whether I just answer in the chat or answer in the Q&A. Thank you again, everybody, for being here. Again, I hope that you're not just walking away a little more educated, but a little bit more comfortable as far as what does this look like? And one final request is when we're done today, we're getting to be, 3:30 in the afternoon. Take some time for yourself. You may dabble in suicide prevention. Maybe you work all day in suicide prevention like myself, but this can be a really daunting talk, raise some emotions. So take a walk, take a bath, hug your dog. We use the term self-care very flippantly, and I really encourage you to take a few minutes out and cut yourself some grace and some peace to be replenished for tomorrow. So thank you all for being here. Please take care, stay safe, and I'll be answering the questions. Otherwise, Sylvia, I'll turn it back over to you.
Thank you so much, Stan. Again, just echoing the appreciations that were mentioned in the chat. So just as Stan said, if you could, I want to invite you all, if you want, in the chat, it's optional, but you can share what you plan to do for your self-care today. As I wrap up a couple slides, I'll be done in a few minutes. So I'm going to grab these slides, but feel free to share in the chat what you plan to do for self-care today. All right. So here, just a few more slides. Just some recommended next steps is to apply what you learned today, the safe messaging guidelines and principles you learned today. Number one, and number two, share what you've learned, this recording, the slides that you will get in a follow-up email within a week. Please share all that with any media, entertainment, and communication partners. So in the follow-up email you'll receive within a week, we'll send the recording, the slides, and we'll also send this handout on the right, which is basically a one-page handout, which has been vetted by Stan and his colleagues around, key tips to remember. And we adapted it for our county with some of our county resources. So it's a really good one-stop place for you to just see all the tips in one page, and you can share it as well. So here, again, just want to emphasize practicing safe messaging guidelines. Really want to share this resource with you all. And we will share the slides as well. And thank you so much to, went back, there we go. Thank you so much to everyone who participated, really engaging in the chat and the Q&A, and appreciate you being willing to learn. So please, again, share in the chat what you plan to do for yourself. And also if you could share something you learned today, that would also be wonderful. And Stan, again, thank you so much for being our guest presenter and sharing your expertise and your lived experience. And just to echo what people said in the chat, your presentation was very moving and very educational. And I look forward to sharing this beyond today. Any last words, Stan, before we close up?
No, again, I think just starting with what when I first told the story, please don't ever underestimate the role that you can have in helping someone find their reasons for living. I've seen it, for as much as suicide has impacted our communities, I have seen far more in my years in this work. People decide to make a different decision. So just take care, stay safe. And it's been an honor to spend some time here with you today. And just thank you also for the love and the compliments in the chat. I wish I could respond to every one of them, but go take your bubble baths and your walks and your hot teas. And thank you again, Sylvia and Zena, for hosting me and inviting me to be here today. It's nice to see you all.
Thank you so much, Stan. And if we have questions beyond this official ending time, do you want to take them after or right now? We just got one question in the Q&A.
Yeah, I can hang out for a few minutes if there's
Okay.
some more questions.
Okay. All right. Well, we officially are ending the webinar, but we'll hang out a little longer just for informal any Q&A that might come up. So thank you all for being here. We'll be sure to follow up by email. Let's see. The one additional question, Stan, was in the Q&A box. Would you utilize the toolkit resources with kindergarten through third grade students? Sorry if I missed this. Thank you.
So I'm not sure which toolkit you're referring to, but I think it applies, maybe not directly. I wouldn't necessarily give the third graders, K through 3 students anything, but I do think it applies to your communications at the elementary school level, right? For parents, we need to demystify suicide prevention for the parents. We need to empower them. I think, again, I talked earlier about this idea of the ivory tower. We really need to get parents to understand that they have a huge, significant role to play, parents and guardians. So I think the idea of safe messaging applies across the board at any age group. And, obviously you're not going to necessarily talk about suicide prevention directly in a K through 3 setting. You may talk about, reasons for living, why do you want to be here, help seeking and stuff. So I hope that makes sense, but I think the principles, what we talked about, apply across the board.
Sounds great. Thank you, Stan. And I don't see any other questions. Oh, I see a hand raised. Renee, I'll unmute you. Let's see.
Hi, guys. Wonderful, wonderful event. Good to hear you, Stan. I love what you said. You really brought it home for me. I wanted to say something because I think a lot of times we got to remember too, some of the medications causes thoughts of suicide. And because I had experience with my daughter, she had because she has anxiety and depression. So they were tweaking around with her medicines, and some of the medication had caused her to start thinking, you know. So what do you think on that, Stan?
Well, I'm not a doctor. I only play one on TV, so I'm going to hesitate to get too, descript with medications and stuff. I'll say this though. I do think that some people have some real good benefits from medications, but I really believe that medications, especially if they're in response to mental health issues, mental illness, specifically suicide and depression, always need to be combined with therapy. I think that's, we come for the quick fix in America, right? I want a pill to make this go away.
Yeah.
We should always start with therapy. If that's not enough, or if there is severe mental illness, then yeah, more likely that meds would need to be used. I think there was a kind of miseducation back in the past, early 2000s when, and this is still true, majority of antidepressants are still prescribed in a primary care setting without a referral to a mental health professional. So let's start by talking about the emotions, and this myth of, antidepressants causing suicide, I think is more that what happened is we gave a bunch of youth who were experiencing depression and thoughts of suicide medication, but never really dealt with the pain that was driving these thoughts.
That's what I'm talking about.
We kind of gave them gave a person who's having thoughts of suicide a pack of Red Bull without ever processing. But medications definitely have their purpose, but I think to each their own, and we need to figure out what's right for that as an individual. And perhaps the most important question we can ask when someone's having thoughts of suicide that we don't do enough is, what's going to make you want to be here tomorrow?
Yeah. I mean, I have me myself with my own lived experience. I got 20 years now. I hadn't had any thoughts of or any. I'm in long-term recovery. So, and I just really like to go straight to it. I don't skip around it. Like if I know someone's not doing well, like my son, he had some challenges last year. And I just asked, do you feel like killing yourself? Do you feel like you don't want to be on this earth anymore? Just talking to him. I'm in his space. But I made sure he understood that I'm here. And if you are feeling like that, we can take care of that. Okay. You're not alone,
Yeah, I agree. And thank you, Renee, for sharing your story, sharing, just being here today. But yeah, I think we just need to get a little suicide is intimidating. It's scary, but at the same time, we almost want to approach it like it's okay. It's not a big deal. You're having thoughts of suicide. Let's talk about suicide. Let's talk about it. That's what's going to help someone find the reasons for living. So thank you, Renee.
You're welcome.
For your courage. I'm glad you're still here, hon. I hope I can connect with you again soon.
And Stan, please let us know if you need to go, but we do have Captain Christina Bell asked, can you say the reason for tomorrow phrase again? I really like that.
I don't know what that was. Reasons for living, maybe is what I was saying.
Yeah, I think you just mentioned it to Renee. At least we got it on recording, but I think you
said
something
sorry, I
about
say things that I don't even know what comes out of my mouth sometimes, but I think I talked about helping someone find their reasons for living, or just, maybe that's what it was. When someone's having thoughts of suicide, like what makes you want to be here tomorrow? Like what makes you want to show up? And again, just normalizing, like if we were really truly honest with each other and went around this room, I am certain, aside from me and Renee, I'm not the only person that's wondered whether or not that knew for sure that I should be. We struggle and it's okay. And sometimes we just got to take the loss. Some days the bear eats you, some days you eat the bear. But we got to look at that hope. I don't think we spend enough time talking about hope.
I think we are good, Stan. So we could see positive comments. So we could wrap it up. And if any other questions come up, I can check in with you separately, Stan, and bring it back to the group.
Yeah, thank you. And I think you identified Christina as a captain. I'm not sure if that's military or first responder, but I do train specific to those populations as well. So please reach out if you'd like to talk about some of those efforts.
Great. Yeah, Stan's an expert in suicide prevention for first responders, and also you also train media professionals too. Is that
correct?
Right, Stan?
Yeah, and I just did a safety stand down with the Marine Corps down in San Diego earlier this morning. So wonderful. All right, thanks, Captain Bell.
All right.
All right. Well, thank you again, everybody. Take care, stay safe. And again, Sylvia, thank you for inviting me to be here today. It's nice to see you.
Of course. Thanks so much, Dan. And thank you, everyone. We'll hope to see you around soon. Take care.
Sounds good. Take care.